Basically, we demonstrated that she's restricted at the first rib on both sides and at T1, and that is probably a hyperflexion injury, so that could be a whiplash. Could come from an insult from playing soccer long ago. Who knows? But the reason I think it's a hyperflexion injury is because her upper cervical is positioned in extension, and I think that's a reflex. I'll show you the hypomobility in the upper cervical spine, and based on my experience, I can say that treating the upper cervical would fail. It would not improve mobility. It wouldn't last very long because it's driven reflexively. It's driven reflexively by the righting reflex because of the lack of motion in the upper thoracic and rib cage. So when I capture the front of her, above her face, the front of her head, temple area, that's necessary to contact there in order to test traction of the upper two joints in the neck, because those two joints are in the front of the neck, whereas the other facet joints of C2, 3, all the way down are in the back of the neck. So if I wanted to test mid-cervical mobility, then I would capture the occiput and test traction. You could do that in a variety of positions. But if I want to test the upper two joints, then my contact needs to be up here. Okay? I have a book chapter coming out on this in December on treating the atlantoaxial joint or the C1, C2 joint. Now, she has good mobility throughout her body. I see her feet bob up and down. I can take up the slack, and then I can spring it, and I see her feet move up and down. And that's true in flexion as well. But when I put her in extension, it gets interesting. So she's at about 10 degrees of extension. And then when I take up the slack, I see the body move. But then when I try and do traction, there's no motion. So she doesn't have spring mobility in the upper cervical spine. Now the way that I separate the first joint from the second joint, the first joint is the occiput and atlas, or occiput and C1, okay, is that I come on the mastoid process and I do a little rotational spring. So I'm just springing towards the floor and it moves beautifully, okay? And that motion is happening, it's so small, it's probably 5 degrees of rotation, and that's happening in the first joint. And then I come underneath the mastoid and I lift up on the right and I easily side bend to the left. Again, less than 5 degrees. And the same thing here. But now when I come on the transverse process of C1, and now I'm pushing on my left index finger, left side of C1, and I'm pushing it to the right, it moves a tiny bit and then it stops. So now I cannot spring C1 to the right. Now when I try and spring C1 to the left, it moves a tiny bit and then it gets stuck and then I can't spring. But if I come down to C2, boom, we have lots of movement, lots of spring mobility on both sides, okay? And then the other test that I like to do is come underneath the occiput, and the first bump that you feel is C2, it's prominent, okay? And I'll say it's maybe a 1/4 inch below the occiput, and I'm lifting up C2 and it moves beautifully. But if I now come right below the occiput and I flex a little bit, so I open up that space a little bit, and now I'm trying to lift up at C1, there's no movement. I'm pushing firmly with my middle finger and there's no movement. So all of this points to the atlas, the atlantoaxial joint, being maintained in hyperextension. And there's an old incorrect subluxation model. This is not a subluxation. This is the nervous system reflexively holding the second joint in the upper neck in extension through muscle. And it's reflex because when I free up the first rib on both sides and I free up T1 mobility, then I expect that to free up. If I'm wrong, I'll say it. Okay? But I've seen this pattern many, many times, and so I say it with experience. Okay? The other thing is that your head is going to be heavy when I try and lift your head straight up, because what I'm doing is I'm trying to lift you up at the first joint. Your head is very heavy. Okay? But if I flex you a little bit, now I'm lifting you up at the second joint. Second and third. Sorry. Third joint, okay? So the C2, C3 joint, when I flex your neck, is moving freely. But when you're neutral and I just try to lift your head straight up, there's no movement. And that's primarily at the atlantoaxial joint. So maybe there's a little, there's a tiny little bit of movement probably in the first joint, the occipito-atlantal, just very slight. But then there's no motion at the second joint. Okay, so we'll treat you and we'll come back and we'll retest that and see if it reflexively releases.
Sounds good.